Moving on, this month is National Vascular Disease Awareness Month, and here to talk more about that is Dr. Vinod Kumar. Dr. Kumar, vascular disease affects about 12 to 20% of Americans, from what I understand. That seems like a staggering number.
Yes, that's very common, and people with vascular disease can be classified into veins and the arterial disease. Vein disease is very common. Patients with leg swellings and leg pains are the ones that are, we think that they may have vascular disease. If anybody has pain, cramps, difficulty in walking, whether pain is during rest or sleep or walking, those are the early symptoms of the vascular disease. Other things are patients with leg swellings, wounds. If they were able to walk few blocks about a year ago and now they cannot walk even half a block, so those are the patients we need to pay attention. Risk factors for something like this is like patients with diabetes, patients with smoking and chronic kidney disease, patients on dialysis. Those are the patients we need to focus and people who are watching this, if you have any of those risk factors, pay attention.
Now, okay, those are some of the risk factors. Is it a certain age group too at all, or?
Anybody over the age 40
okay.
Should pay attention to, or even 35 for the veins. But people with arterial disease, where they have the wounds on the legs or the tips of the foot, if they are the age group of about 65 plus.
Okay, so is there something that people can do, maybe lifestyle-wise, to try to help prevent this?
Yes, absolutely. They have to really watch, look at their feet, see if there's any early sores, if they have any swellings, if they have any pain or cramps. They should get early attention. Nowadays, the technology is so advanced, we can not only identify the disease early on, but we can treat it.
What about with like diet or habits that people have?
Right. Actually, exercise is extremely important. Okay. You know, for continuing the circulation in the legs and the foot, the blood goes and comes back up. So if the people continue to exercise and walk, that's extremely helpful.
Okay. Is there any specific type of, is it better to do like cardio or, you know, weights, muscle?
Yeah.
What?
See, cardio and walking. Brisk
okay.
walking is one of the best exercises you can do for the legs and feet.
Okay. And how often should people be doing that?
They should be doing every day, 45 to 60 minutes. 45. American Heart Association recommends that we should exercise 45 to 60 minutes 5 times a week or more.
Okay, so even simple things like taking the stairs instead of an elevator can help with that?
Absolutely. You know, you park your car at the last spot at the workplace, or take elevators instead of the elevators, take steps. So those are very helpful things.
Those are things that can help, especially if you're busy and you don't always have time to exercise, although you can always make time, I find.
That's right.
Now, you guys are doing a free screening that, from what I understand, you have one on the 20th of this month, but that one's pretty much full, so you have another one on the 27th.
Yeah, we had to open on 27th because 20th was already full, and this is the National Vascular Awareness Month. We didn't want to let anybody, not take the advantage of it.
So how can people sign up for that? They just need to call? Or?
Just call the office number 324-4100 and reserve a spot. It's a free screening.
Okay, and what are that's the number on your screen, of course. If you want to have a free screening for the vascular screening, you can go ahead and call that. And then that is from 8 to 12:30, is that right?
Yeah, 8 to 12:30 on Saturday.
On the 27th of this month, you can call today. Those phone lines open at 8. All right, thank you so much, Dr. Kumar.
Thank you very much, Katie.
We'll be right back.